All right, I have a question for you. Do you have high blood pressure? Chances are you're keeping tabs on it or maybe even taking medication to keep it under control. But you should know the guidelines have changed. Senior health correspondent Monica Robbins joins us this morning to explain what the changes mean.
Thank you, Danita. Yeah, according to the CDC, nearly 48% of Americans over 18 have high blood pressure. The majority, of course, being those over age 60. But blood pressure guidelines change. And to help sort them out are joining me Sonia Vesmar from the American Heart Association and cardiologist Haitham Krasha of University Hospital's Harrington Heart and Vascular Institute. Thank you so much for being here.
Thank you so much for having us.
I will start with you, doctor. So the guidelines have changed. What does this mean?
So the guidelines, the new guidelines are just released 5 days ago from 2025, and they are the first update since 2017. And the new guidelines focuses on early detection and early treatment for high blood pressure. So in the old guidelines, people with intermediate high blood pressure, like 130/80, we did not used to treat them unless they have coexisting condition like diabetes, chronic kidney disease, or obesity. In new guidelines focuses on we need you to take an action now. So we need you to treat your blood pressure as soon as it is above 130/80 with lifestyle modifications for 3 to 6 months. And then if that does not help, then we can recommend medication treatment. And all that is because we know that high blood pressure can lead to a various array of complications like dementia, strokes, or heart disease.
When you talk lifestyle modifications, what's the easiest thing somebody can do?
Oh, there are multiples of that. So first of all, your salt intake, the recommendation is less than 1,500 milligrams per day. Channel your stress through exercise. Try to lose some extra pounds here and there. Practice yoga, meditation. Those are kind of some of the lifestyle changes that we recommend to patients.
Do you think one of the biggest issues is people actually don't even know their blood pressure?
Absolutely. And you know what, as you kind of mentioned, 50% of Americans have high blood pressure. 50% of those with high blood pressure do not know that they have high blood pressure. And that's why we call it the silent killer. Because it kills people without knowing that they have it.
So, Sonia, one of the things the American Heart Association does is provide people an opportunity to go get their blood pressure checked for free. But where do they go?
Well, right now, we are working in the county of Ashtabula. That is a rural county, and so because of the way it's set up, there's not a lot of easy access to resources. So we are working with the libraries so far. We're hoping to extend it to all of the libraries across Ashtabula County, where they can go to the library, they can take their blood pressure for free. There's a kiosk set up, just kind of a little bit like if you were to go to a pharmacy. And then if they find that their blood pressure maybe doesn't look right based on the information that's provided to support continual, like the idea is to do screen, educate, and refer. So screen your blood pressure. If you feel like you're not sure what that means, we have lots of education set up there available. And then if you need to learn more, then there's information to encourage people to see their primary care physician or another health provider.
So what is high blood pressure? So if somebody takes their blood pressure and they see those numbers, most people don't even know, what does it mean when I have high blood pressure? What's the numbers that you need to pay attention to?
Sure. So there are two numbers with blood pressure, the top number and the bottom number. Currently, the guidelines classify blood pressure 130/80 as hypertension or high blood pressure. Like prior to kind of 2017, we used to say above 140/90, but nowadays we change that into 130/80.
So those are the numbers you want. Anything less than that is you're okay.
So we would love to see your blood pressure below 120/80. That's where we like you to be. Between 120 to 130, we call it a pre-hypertension, or the period where you're in the gray zone or yellow zone. And then above 130, that's where the red zone is.
And most important thing, if you don't understand any of this, talk to your healthcare provider.
Oh, absolutely.
Or if you think you might be at risk.
Yes.
Is family history a big a risk factor?
Oh, absolutely. Family history, other comorbidities like obesity, for example. Did you know that for every 1 kilogram, which is 2.2 pounds, you lose from your weight, your top number goes down by 1 point. So if you lose 20 pounds, you might not need even medications.
Wow, great tip. Thank you so much. Thank you so much for this information as well. There you go, Danita. That's all we need to know, right?
That is all we need to know. And let me just say, I'm with this. Both my parents have high blood pressure. I have my own monitor at home. I keep track of my blood pressure. Everything they're saying, I've changed my diet because you got to stay on top of this because it is a silent killer. So we got to know. So thank you for this information today. Right on time, Monica.